guys, my name is Gracie Van Wagener, and as you saw from that video clip that we're going to be talking about hypoglycemia. So based off what you have observed or seen from that video, I would like you to describe hypoglycemia to the best of your ability. Okay, so hypoglycemia is a condition in which your blood sugar or glucose level is lower than normal. Glucose is your body's main energy source. So you can see how this would be a problem for if your glucose levels are low, then you won't have as much energy as people and you might crash. So, hypoglycemia is often related to diabetes treatment. It usually affects those with mild to moderate type 2 diabetes, but other conditions and a variety of conditions, many of which are rare, can cause low blood sugar in people who don't have diabetes. After hearing this description, what do you think are some ways that people could use to bring those blood sugar levels back to normal? Okay, so treatment involves quickly getting your blood sugar back to normal, either with high sugar foods or drinks or with medications. Long-term treatment requires identifying and treating the cause of hypoglycemia. So, examples of food to eat when blood glucose level is low would be hard candy, juice, glucose gel, or tablets, or basically just anything that has really high levels of sugar that can get your glucose levels back to normal as quickly as possible. Okay, so based off of what I just told you and what you have observed from the video, I would like you to list 3 other possible symptoms that you think one with hypoglycemia might have either right before their episodes or during those episodes. Okay, so some symptoms include an irregular or fast heartbeat, fatigue, pale skin, shakiness, anxiety, sweating, hunger, irritability, tingling in the numbness of the lips, tongue, or cheek, dizziness, crankiness, and some symptoms for when it's getting worse include confusion, abnormal behavior, or both, such as the inability to complete routine tasks, visual disturbances such as blurred vision, seizures, or loss of consciousness. So the example that we saw from the video clip would be one of the more worst case scenario examples. So what do you think that people with low blood sugar levels or people can do to prevent those low blood sugar episodes from happening in the first place? Okay, so some things that they can do are to check the levels often. So regularly checking your blood sugar level can help you keep it in your target range. If you've had low blood sugar episodes in the past, you may wish to check your blood sugar levels before driving or operating machinery. And then they should talk to their doctor about when and how often they should check their blood sugar. So the reason they want to check those blood sugar levels before driving and or operating machinery is so they don't have those extreme episodes while they're doing things that could harm themselves or other people. Another thing that they could do to prevent those episodes from happening is to snack smart. So they could consider having a snack before they leave their home, or if they know it will be more than 5 hours before their next meal, or even if their blood sugar levels are less than 100 mg/dl. It's a good idea to always keep carbohydrate-rich snacks on hand with them at all times in case their blood sugar dips while they're out and about. As mentioned above, some other good choices for them to get their levels back to normal include granola bars, fresh or dried fruit, fruit juice, pretzels, and cookies. So, based off of what I have told you so far, why do you think those with type 2 diabetes might also have hypoglycemia? And after you submit this answer, I would encourage you to go out and do that research on your own and find out more about hypoglycemia. Thanks for listening.